Well, I don't need the vaccine. I never get the flu.
I mean, why bother? There's no guarantee it's going to work anyway.
I'm worried about getting a bad reaction to the vaccine.
Oh, I just can't stand needles.
My boss doesn't get vaccinated, so why should I?
I'd have one if they were free.
Influenza is a deadly illness. 2,000 to 3,000 people die from influenza in Australia every year, and a large number of those catch the infection in hospital. We really need to do something about this. Every year in Australian hospitals, we see a large number of cases of influenza that are caused by the staff bringing influenza in from home. We are taught when we're doctors and we're nurses a Latin term, primum non nocere, and that means first do no harm. So you always have your patient's interests at heart and you don't want to do any harm at the very beginning. And unfortunately, if we don't get vaccinated, we are doing harm.
A lot of the outbreaks start off with healthcare workers who might acquire the infection from their children, for example, or their partners, and they may bring the infection then to work and infect patients who, of course, have suppressed immune systems and are not necessarily very well.
In a number of instances of influenza outbreaks, what we refer to as the primary case or the index case, we've found to have been a staff member, be that a nurse, a personal care worker or assistant in nursing, or even ancillary staff such as cleaners.
I'm currently working on a research project with the Australian Paediatric Surveillance Unit. We identified all the children admitted during 2007 who were flu positive. We found 122 children, of whom about 10% or just over 10% were nosocomially acquired. In other words, the infections were acquired in existing inpatients.
Influenza doesn't just materialise in a nursing home. It has to be brought in by someone, be that visitors or relatives of aged people, or, as we're finding, staff.
My mother's in a nursing home. She's looked after really well by the staff there, but I do worry that she could catch flu from me or from the people who are caring for her.
My own father died as a result of influenza because he had a heart attack. A lot of people don't realise that strokes and heart attacks in the elderly can be caused by influenza, and that's a very common occurrence. Recent research has shown something really quite exciting. If you can increase the immunisation rate against influenza among the nursing staff of nursing homes from the background of 10 or 20% up to 50% or more, as has been achieved in a nursing home like this, then you can do something really quite remarkable. The death rate from all causes during the flu season can be reduced by as much as 50%. Quite extraordinary.
One of the things that always comes out is, oh look, if I have the vaccine, I'll get the flu. But of course, influenza vaccine isn't a live vaccine, so it doesn't give you the flu.
The influenza vaccine is a very safe vaccine and very effective. And one thing I can assure you is absolutely you can't contract influenza from the vaccine. I know this because I was involved in the vaccine development. The virus is purified, killed chemically, and then broken into little pieces, and it just can't cause influenza.
Oh, the vaccine is really effective, somewhere between 70 and 90% effective in young adult people. And really, it's the young adult people who don't realise that being vaccinated is so beneficial not only to them, but to the patients.
Well, I don't need the vaccine. I never get the flu.
I think influenza vaccination is very important for all healthcare workers. Particularly young healthcare workers need to be, perhaps they need a little bit more convincing. They believe that they're young and impervious to illness.
Some people say they never get the flu. Well, aren't they lucky? But to be honest, even if you get a mild cold, sometimes that's actually the flu. And that mild cold can be passed to a patient.
Look, it's absolutely imperative that healthcare workers are vaccinated against influenza. This is the only way to protect their patients, the people who are most at risk. And unfortunately, what healthcare workers often don't realise is that even if they go home and go to bed once they feel ill, they may have already done the damage. You spread influenza before you really start to show the symptoms. And even if you only do have a mild infection, it's something that may be much more severe when you pass it on to your patient.
I'm worried about getting a bad reaction to the vaccine.
The influenza vaccine, like all the vaccines that are licensed for use in Australia, is safe. There are some side effects, like with any vaccine, mostly related to pain at the site where you have the injection.
The most common side effect of influenza vaccination is a mild sore arm.
Some people will have a sore arm for a few days after they've had the shot. I've never had that experience myself.
I have it every year, and I've had no side effects whatsoever.
As a healthcare worker, you have a responsibility to do the best thing for your patient, and the best thing you can do is to prevent any transmission of flu from you to them.
Studies have shown that annual vaccination of healthcare workers is the most important means of protecting these vulnerable patients.
We might think we only need to have the flu shot occasionally, but the flu virus is changing all the time, and so that's why the vaccine is updated each year.
I have the vaccine every year. I have done so for many years, and all my family do too. I've worked with influenza for about 40 years. I really know what a danger it is.
If we can increase the vaccination rate sufficiently in hospitals and other healthcare facilities, we can actually have an impact on the transmission of the virus. We can raise the level of herd immunity to such an extent that we reduce transmission of the virus in those workplaces and even in the community.
By being vaccinated, I protect myself, I protect my workmates, I protect those I care for, and I protect my family.
This is something that's worth having. It's something that will protect yourself, and even more importantly, it's going to protect your patients. So do get immunised this year.
I get vaccinated every year, and I just think it's a responsible thing to do.
It's better to be protected.
I haven't had a flu since I started regular vaccinations.
I get vaccinated every year.
Occasionally I get a sore arm, but it only lasts for a day or two and it's fine.
I think it's our professional duty to get vaccinated and protect our patients.